How can a neurological exam rule out serious headache conditions? Imagine going to the doctor because your head is pounding, and you're worried it might be something dangerous. The doctor will perform a neurological exam to help figure that out. This exam is like a detailed checkup for your brain, spinal cord, and nerves. It helps doctors tell if your headache is just a common migraine or something more serious. When you arrive with a headache, especially if it's sudden, severe, or unusual, this exam is the first step to understanding what's going on. The doctor starts by asking questions about your symptoms. They want to know how your headache began, how long it lasts, and what it feels like. They also ask if you see any changes in your vision, feel weakness, numbness, confusion, or if you have seizures. These details are important because certain patterns or warning signs, called red flags, can point to serious issues like brain tumors, bleeding, or infections. Next, the doctor looks at your overall appearance and checks your vital signs like blood pressure, pulse, and temperature. They examine your head and neck for swelling, tenderness, or signs of infection. They also look into your eyes, checking for redness, pupil reactions, and eye movements. Sometimes, they use a special light to look inside your eyes for swelling of the optic nerve, which can mean increased pressure inside your head. The core of the exam is the neurological assessment. The doctor tests your mental alertness, memory, and ability to think clearly. If these are affected, it could suggest a brain problem. They then test your cranial nerves, which control your face, eyes, hearing, and swallowing. For example, they might ask you to follow their finger with your eyes or smile to see if your facial muscles work properly. They also check your muscle strength, tone, and coordination. Weakness or abnormal movements can point to nerve or brain issues. Reflex tests are done to see if your nervous system responds normally. Abnormal reflexes can indicate nerve damage. The doctor also assesses your ability to feel touch, pain, and vibrations. Loss of sensation might mean nerve or spinal cord problems. Balance and coordination are checked through cerebellar tests. The doctor might ask you to walk in a straight line or touch your nose with your finger. How you walk and stand can reveal subtle neurological issues. Most people with common headaches or migraines will have a normal neurological exam. If everything looks normal and your history doesn't show warning signs, the chance of a serious problem is low. But if the exam finds abnormalities, like weakness, vision changes, confusion, or abnormal reflexes, it raises concern. In those cases, the doctor will order further tests like a brain scan using computed tomography or magnetic resonance imaging, or even a spinal tap. This exam is a quick, non-invasive way to screen for dangerous causes of headache. It helps doctors decide who needs urgent testing and who can be reassured. For many with typical migraines, a normal exam confirms the diagnosis. For those with unusual symptoms or abnormal findings, it's the first step to finding and treating a serious condition. In the end, the neurological exam helps rule out serious headache causes by carefully checking how your brain and nerves are functioning. If the exam is normal, serious problems are unlikely. If there are issues, further testing can identify the problem early, leading to better treatment and peace of mind.